In this section, we explain the key changes to the PACES examination to be introduced in October 2009. Please refer to the written material available on the MRCP website for further information. Firstly, it should be stressed that the majority of the content of the examination and the basic method of assessment do not change. In particular, note that the total cycle length of 125 minutes and the number of stations are unchanged, that examiners still work in pairs, and that assessment is based on observation of the candidate-patient interaction, followed by a discussion of methods, findings, diagnoses, and management. Importantly, the overall standard of the examination should not change. We do not wish examiners to change the level at which they pitch their assessment. This will be further discussed later in this section. Now to the changes. There are three main changes to consider: the changes to what is assessed and how it is assessed, the changes to the PASS standard, and the changes to the structure and content of Station 5. Firstly, what is assessed and how we assess it. Following review of the new curricula for medicine and the GMC's Good Medical Practice, we have redefined what is assessed in the PACES examination. This slide shows the 7 new core clinical skills that are to be assessed, and these core skills can be regarded as equivalent to the anchor statements in the current examination. However, in contrast to the anchor statement skills, each of these new skills will now be explicitly marked, and candidates will have to attain the required standard in each of the skills if they are to pass the assessment overall. The 7 skills are physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patients' concerns, and maintaining patient welfare. The descriptors for each skill are enclosed with the written material provided on the MRCP website. At each encounter, a different number and combination of clinical skills is assessed, as is shown here. The number of skills assessed ranges from a minimum of 4 at the Communication and Ethics encounter, Station 4, to a maximum of 7 at the new Station 5 encounters. This pattern of assessment by paired examiners allows each skill to be assessed between 8 and 16 times in the course of the entire cycle. Candidates will be aware of the skills they must demonstrate at each encounter, and examiners must ensure that each skill is assessed. The changes in the skills assessed lead to changes in the mark sheets. The new mark sheets do, however, appear familiar in many ways. For example, in this mock-up of the new mark sheet for the respiratory encounter, note that the top third of the mark sheet contains the same identifying information as at present. At this encounter, 5 of the 7 skills are assessed, and these are identified in the left-hand column. Examiners must award a mark for each of the skills assessed, using the skill descriptors on the mark sheets and their own calibration records to guide their judgments. A new 3-point judgment scale is used, with an unsatisfactory judgment worth 0 marks, a borderline judgment worth 1 mark, and a satisfactory judgment worth 2 marks. We will return to the use of the borderline grade on the next slide. When considering the standard required to attain a satisfactory judgment for each skill, consider whether or not the trainee is performing at the level necessary to assess and manage patients effectively and safely in a typical acute take or general medical outpatient clinic. Space is available on the mark sheet to make comments about unsatisfactory performance, and a counselling tick box is also retained. Finally, note that it is no longer necessary for examiners to construct an overall judgment mark regarding overall performance at the encounter, but simply to provide judgment marks about each assessed skill. As already described, judgments are now made on a 3-point scale rather than the previous 4-point scale. This slide shows how the old and new scales can be compared. Previous clear pass and pass judgments should be regarded as the equivalent of a satisfactory judgment, and previous fail and clear fail judgments as the equivalent of an unsatisfactory judgment. The borderline option is a new and narrow judgment grade, available to examiners when they feel that the candidate has not quite done enough to merit a satisfactory award, but deserves some credit for what they have demonstrated. It is not anticipated that examiners will find the need to use the borderline grade frequently. For example, in the pilot examinations, it was used in only 8% of judgments. As described earlier, calibration is a vital part of the standard setting process in clinical examinations such as PACES. There are now calibration sheets for all stations. Examiners should use these sheets to record their agreed findings and the agreed criteria for the award of satisfactory judgments for each skill assessed. During the assessment of a candidate, examiners should refer to their calibration sheets and the additional generic skill descriptors found on the mark sheets, each of which will help guide judgments in a consistent manner. Assessment of each skill in each candidate should be based on the standard expected of a trainee who is ready to leave core medical training and move into specialty training.